Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening, everyone. This is Dr. Joseph Kanu, broadcasting live from our office in downtown Rochester. And we have with us tonight Dr. Jeffrey Haddad. We are going to be covering Mercury amalgam fillings. If anybody has any questions on the dental topic, we're going to accept questions tonight, mainly with TMJ, migraines, bruxism, amalgam fillings. Anything else, Dr. Haddad, you can think of?
I think everybody has some kind of dental story or question in their life. For some reason, people love talking about their teeth, so I don't think we'll have any trouble there.
Yeah, so you can contact us and call the station at 313-838-1035, and Michael, our producer, will put you through. And I would like to just say a prayer. Dear Heavenly Father, guide this show tonight. Give us wisdom and help us gain more knowledge and wisdom so that our Lord's people will not suffer and perish for lack of knowledge. In Jesus' name, amen. So last show, we've covered migraine headaches with you, and we covered some TMJ issues, right? And tonight, I know I would really like to get to the Mercury amalgam fillings. And
you've been waiting for weeks to get back to this.
I've been waiting, pounding, chomping at the bit, chomping.
Yeah, well, you know, we a few weeks ago we talked briefly really about just the better materials out there. And, you know, you and I have talked about this many times about this topic of, you know, are there the potential health risks with these Mercury amalgam fillings? And there's a lot of unknown, you know, data out there, but there's a lot of
some conflicting information.
Very much so, absolutely.
It almost seems like it's sketchy science. I like to say. You know.
Yeah. Well, you know, it's there's a lot of common sense stuff too. That you know, when people ask me, you know, would you use this, you know, material in your mouth? And I say no, I wouldn't. I don't have any in my mouth. I wouldn't put it in my family's mouth, and I definitely wouldn't consider putting it in my patient's mouth. And there's a lot of reasons for that. And if I know you want to get to the health risks, which let's talk about that. I mean, there are all these symptoms and neurological situations and autoimmune diseases that are very much proven association with mercury poisoning. Mercury poisoning? Absolutely.
Yes.
Now, is there enough mercury in these fillings to be causing or adding to these things? That's the dilemma. That's the controversial topic there. Well, here, you ask me, why would I take a chance?
Why would you
take a chance? Why would anybody want to when there's no benefit to this material? It's an outdated material. We talked about it. It was used in the Civil War. I would be embarrassed if, you know, I was doing something that has been in my profession 150 years ago with all the advances in technology. You know, it's back there when they were sawing legs off, you know, to cure people. I mean,
the age of leaches. Let's put leeches on you and suck out the poison.
I think we've come a long way. I don't think we need to go. I don't think we need to go backwards. And so, you know, right off the bat, just from materials choice, I think it's a poor choice. And then you start adding all these potential ways that it could affect your body. It seems like a no-brainer to me, you know, and I know that you've had a lot of experience with patients.
I have had a lot of experiences over my 28 years of people who've had fibromyalgia, even MS-type symptoms, chronic fatigue, and sometimes we always try to pray to find the root cause of the problem. of their, and is it, I need to sell them a new vitamin or health product, or sometimes what we need to do is we need to get rid of. It's not the new what we need to take in. What we need to do is get rid of. We covered liver cleansing pretty extensively and gallbladder cleansing, and this mercury, I don't know if you listened, 2 nights ago we did a show on high fructose corn syrup.
That's good.
And with high fructose corn syrup, and that's a lot of sketchy science too. And what, as listeners, and when we research on Google, number one, how do you know what to believe on the internet?
Right.
But number two, who did the study? Who financed? I always like to know who financed the study.
Right.
Yeah. Was it the drug companies that are promoting it, or the manufacturers who are promoting it? Who's backing these studies?
Well, there was those great commercials too on the high fructose corn syrup. Literally, dispelling the myths and saying how good it was for you.
Right,
and it's like,
right.
There was a lot of money in that marketing campaign.
There was a lot of money in that campaign, yes. And like with the mercury, some people can have a mouthful and not have an issue. Some people can have one filling.
Right.
So with the high fructose I was sharing, my own son had severe toxic reaction to high fructose. As a 2-year-old, bleeding of the rectum. I mean, it was horrendous.
Yeah.
And there's nothing like a parent seeing their kids suffer. And I would just cry out to God, God, I'm a rotten sinner. Afflict me with this. What did he do as a 2-year? I know that's not right thinking, but that's how you think at the time. But so we searched, and it was high fructose, and that was before high fructose really had a bad rap. But anyways,
but along those lines, I mean, I think you said gave a perfect example. Let's say certain people have certain levels of adapting ability to maybe some of these toxins in our environment, or some of these
lower tolerance or higher tolerance.
Right. I mean, how do you know if you're that person or not?
Yes.
So why would you take the risk if there's even the potential chance that it could affect you adversely? So
or if you don't even know, we have this running dialogue of the brain and the spinal cord is electric. We run on electricity, and what causes interference, what boosts our electrical conductivity, what lowers it.
Right.
And it's just, mercury is just one of those things. But getting to the high fructose, here's the point. 50% of the samples that were taken have toxic levels of mercury in it.
Right.
Toxic levels. So you're eating high fructose, you have a 50% chance you're absorbing a lot of mercury.
Oh, back to, I think that's great. That reminds me of this quote, or this stat that I found here too. Multiple sclerosis patients have been found to have 8 times higher levels of mercury in their cerebral spinal fluid compared to neurologically healthy individuals. Right there.
I want you to repeat that to our listeners.
Ooh, let me drink my glass of water here. That was a mouthful. Multiple sclerosis patients, MS have been found to have 8 times higher levels of mercury in their cerebrospinal fluid compared to neurologically healthy individuals. Again, you can have the argument of where the mercury came from.
Where?
Who cares? I mean, why? Let's not take a chance and add more into your body.
Right. Is it from tuna? Is it from high fructose? Is it from your dental filling?
Right. And so that it's a question that I don't want to have to ask, and I don't want to have to go down that road with any patient.
No.
And most patients are pretty educated these days, and definitely don't want it in their system. They don't want me to put it in. So if you've already got it in there, it may be time to consider replacing that. It's been in there long enough, okay, and it's not doing you any good.
Right. Hey, Doc, we're having a caller come in.
Great.
Can you, hi, Phil, you're live and on the air.
Okay, greetings. What's up, Doc? Hello.
Hi, Phil, how are you?
Hey,
yes.
Look here. I'm a senior citizen. Can you hear me?
Yes.
Can you hear me?
Yes,
we can.
Yes, we can.
Can you hear me? Can you understand me?
Yes. Hi, Phil. Yes. Do you have a question for Dr. Haddad?
Yeah. Is there any place that I can go in Michigan particularly in the Wayne County area, that I can get my mouth repaired. I need veneer or something. My front teeth are missing. And I got I'm a senior citizen. I got Medicaid and Medicare, and the dentists the several dentists that I went to, they either don't accept Medicare or they give you a ultimatum. They say, we'll pull all your teeth and we'll give you a partial. I don't want my teeth pulled. I just want the front replaced. I need about 4 teeth in the front. That's all I want. Is there any place in Michigan that I can go and get that?
Well, that's a good. Medicare. That's a good question. Phil, do you get on the internet at all? I guess is my first question.
I didn't hear you.
Do you get on the internet at all?
Do I have what?
What I would recommend is calling your Medicaid provider, and they will direct you to a dentist that will.
Sir, doctor, please. I've been trying to get this since October of 2010. I signed up at some hospital. They said, we got a waiting list. We'll see you in January. This was in October 2010.
What I would recommend, Phil, is there's a better idea. I'm going to send you to either my alma mater, which is the University of Michigan, or right in downtown Detroit, University of Detroit Mercy. Both are excellent. You will get excellent care there. They will take good care of you, I promise.
Well, Medicare covered, I'm saying.
Yeah, absolutely. That's exactly what they cover there, and then they will accept it, and that's a very good stop for you. So, I don't have a phone number offhand. I'm sorry, but if you'd like, that's correct. If you'd like, you can call my office at 248-656-2020. The ladies there can direct you to one of those schools, whichever one is closer to you. Okay?
Well, fabulous. Thank you for your call, Phil.
Good luck, Phil.
Okay. Yes.
And that number is 248-656-2020.
Yes, and Phil will be praying and hoping that everything comes out. You call us back and let us know how that worked out.
I'll tell you, that reminds me, Dr. Joe, you and I were talking about a future show, which is dental implants. And that sounds like what Phil wants, which is to replace the teeth that he lost. I just got back from a really advanced course in Summerlin, Nevada that I'll tell you, the technology that is out there to replace people's teeth is amazing. So that is going to have to be a future show.
Wonderful.
And you'll like it because it's titanium, which is a very, very acceptable, stable metal.
Not volatile like mercury.
That's correct.
So, anyways, we have a whole symptomatology of mercury poisoning.
Correct.
Right? Did you want to go over that, Jeff? What are the symptoms of mercury poisoning?
Wow. All right.
Because you know what, this show, what I would like the listeners to get is this. If you have, and this is my opinion, okay, if you have mercury amalgam fillings in your mouth and you want to live a more healthy life with more vitality and energy, and you want to stop the interference, one of those things that causes major interference because it causes liver toxicity, get the amalgam fillings out of your mouth. Whoever you go to, try to set up a plan, and we can give you all kinds of reasons why. We talked about how the mercury amalgam, it's a wedge, right?
Correct.
You pound it in, you're going to crack, just from pain and cost-wise, you're going to split the tooth. You'll need a
more invasive procedure, a root canal. You may lose the tooth.
Okay.
A crown at least.
So you need the root canal. That costs what, about $1,200?
Sure.
And then a crown is how much?
Another, $1,000 to $1,500.
$1,500. So now we're talking $2,500 to have that. So down the line, you are going to have problems. Plus, that mercury amalgam leaves pockets, right, where bacteria gets in. Mm-hmm. So you can have this low-grade problem. It can be causing other symptoms that you don't even know are from your teeth,
right,
are from these mercury amalgams. We need to get these out. So
and Joe, let me stop you there real quick. I think even back to our other caller, who there's a lot of people who have insurance, questions. And I think a lot of people don't realize that getting these silver mercury fillings out of your mouth, this is not cosmetic in nature. People think, they're going to put white ones in, so it's cosmetic, and my insurance isn't going to cover it. That couldn't be further from the truth. This is a functional thing. Those fillings, unless they've replaced in the last 2 years, are failing, okay? I promise you. Most of the people out there that are listening, I guarantee that they've had fillings in there for the 20, 30 years. People, just because they're not falling out of your head or hurting you does not mean there's a problem, and does not mean that things are not failing. And your insurance company will help you. No insurance company covers everything, as you and I both know. Yes. I don't want to get into the insurance, nightmare discussion, but they will help you. So don't be opposed to at least considering getting an area of your mouth taken care of, maybe a year. Stay within your insurance budget, but start proceeding.
Have a plan.
Have a plan.
Have a plan. Work the plan.
Exactly. And with as far as people's choices of what another material may be for fillings. Mm-hmm. I spend a lot of time on my website, as you know.
Yes.
Please take the time. Go to RochesterAdvancedDentistry.com. There's an entire section on alternatives to these mercury fillings. It'll really give you some education there.
Great. Hey, Jackie, you're on the line live and on the air with Dr. Haddad.
Hi, Jackie. How are you?
I'm wonderful, except my mouth hurts just listening to you guys.
Oh, no. We can help you. Don't you worry.
I have so many of those horrible fillings that you're talking about, except for the ones that have fallen out of my head.
Oh, all right.
And I do not have insurance at all.
Okay.
What would you suggest?
Well, that's a good question. To be honest, I actually like hearing when people don't have insurance, and I know that sounds strange, but it's because, unfortunately, most insurance companies, they aren't going to allow you to do what's best for you. Your doctor cares about you. I care about you. Dr. Joe cares about you. We're going to give you a game plan, and an insurance company is going to say, well, maybe we'll help you there. So I don't think insurance is your answer. I'll be honest. You have better options where you can choose to spend your money to help your own health. Mm-hmm. But your dentist, in our office, I can speak for myself. We have majority of our patients don't have dental insurance, and like Dr. Joe just talked about, we figure out a game plan. We make it so that it's affordable for you. We don't necessarily have to do the whole overhaul here. It's something that we can do and maybe take an area at a time and move along. A lot of people stay away from the dentist and don't get cleanings because they don't have insurance. Well, how much does a dental cleaning really cost you? Maybe you get 2 cleanings a year. That may cost you, I don't know, $200 to $300 for the whole year. Mm-hmm. I think the majority of the people out there, I'm hoping, can afford that. And if it's a priority for them, they can. And it's the same thing here, Jackie, with your fillings. The first step for you is to find out what it would take to replace these, and then figure out a game plan that works within, your budget.
Mm-hmm.
So, Jackie, about how many fillings do you have? She's laughing.
Don't be shy.
Let's. How about we count the ones that aren't filled?
Ooh, that's a good one. Well, I'll tell you, we there's a little joke when we take a lot of filling material, especially these silver mercury fillings out of patients. I'll take 3 teeth and take care of that, and they're about 2 pounds lighter. It's an amazing thing when you take that much metal out of people's mouths. Jackie, I'll tell you, in all seriousness, and I appreciate people's finances, and this stuff can get expensive as far as the investment goes. There are lots of ways out there to help people. There's even outside almost credit card type companies called Care Credit that will help you with things like this, chiropractic, a lot of things that insurance companies don't cover.
Tell me this. If she came to your office, what do you do for like a consult or a...
First thing we would need to do, depending on the last time you'd been to the dentist, Jackie, is obviously we need to get some x-rays. I need to see what's going on underneath these fillings, and you need to know what's going on underneath these fillings.
What is going on underneath?
And at that point, we need to decide what the best option is to fix that tooth. And it depends. I'm gonna simplify things. It depends on the size of the hole. All right. If you've got a small little silver filling in there, we can replace that with a tooth-colored composite filling, which is essentially a plastic filling, much more compatible with the body, and it's adhesively bonded to the tooth, which actually reinforces the tooth. If you've got a very large one, maybe one that's already fallen out and you got a big hole there.
Yeah.
You may be in that realm where we do need to put a crown or a cap on top of the tooth. But again, no metal is used in my office. It's all porcelain, glass that your body treats as though it's your natural tooth. And then some people have it where it's right in the middle. Yep. You know, it's about half the tooth, but there's a lot of good tooth structure, and we'll bond what's called a porcelain onlay. It is a porcelain puzzle piece that is, again, adhesively bonded, and once it's in there and bonded to the tooth and the porcelain, it's whole again. It looks natural. It feels natural. It's so much stronger than that wedge of metal that you have in there that's expanding and that you can come down on and just break the tooth and, like we talked about, maybe even lose it. Yeah. So I believe you're on borrowed time with a lot of these, to be honest. And I see a lot of patients like you here, Jackie.
Are there any other questions, Jackie?
Yeah. What's your phone number?
All right, perfect. It's 248-656-2020. And again, you know, Jackie, I'm not sure if you heard this or not, but go to our website, because I really took a lot of time to put our alternatives to fillings like this on there. And it's RochesterAdvancedDentistry.com. And you will really educate yourself. And please come in with questions. I love when patients come in and they've done the research and maybe there's some questions they still have. I'd be happy to fill you in on some of those voids.
Doc,
thank you for calling.
We only have a little bit of time left. I wanted to cover some key issues.
Okay.
Also, Jackie, you know, our Simple Truths for Healthy Living website, simpletruthsforhealthyliving.com. There's a link to Dr. Haddad's clinic there. Because Mercury, let's get in. I want to get into the symptoms.
Okay.
What are the symptoms of mercury toxicity?
All right. Here's a list that have been associated, again, with overall mercury toxicity: poor memory, inability to focus, anxiety, insomnia, dizziness, autoimmune diseases like lupus, fibromyalgia. Chronic fatigue syndrome is one I hear a lot. In fact, I've even had several physicians send their patients to me specifically to have their fillings taken out based on their autoimmune disease or their chronic fatigue syndrome.
A lot too.
Yeah, well, listen, again, back to common sense. If there's not a clear reason why you're having some symptoms, some kind of a pathological situation, and your doctor's, you know, wondering, hey, you're not doing yourself any favors by not doing anything.
Right.
You know, have an action plan, and if your physician is recommending it, you really should consider it.
Yeah. Well, it's all about lowering your tolerances to other diseases.
I agree.
Right? Now, if we talked last time, 2 fillings will cause a 10-acre lake to be toxic.
Correct.
Well, let's say you have 4 fillings in your mouth.
Ooh, yeah.
Okay. So tell me about this.
Well, I know he loves this stat,
I love
folks.
This one.
This is a good one. Studies show that the average person makes and swallows 1.5 liters of saliva a day. Yet if they have as few as 4 amalgams present in their mouth, their saliva is so high in mercury they cannot legally spit into the toilet in the USA, which I thought was an amazing stat there. I mean, it really is. And I think that's a little bit tongue-in-cheek there. But
so now, if anybody has more than 4 mercury amalgam fillings in their head, please do not spit in a public restroom. Just swallow it and keep internalizing all that mercury. Please don't contaminate our sewer system.
Right, God forbid.
What does that tell you? So anyways, we do have a caller, Carla, on the line who's been waiting patiently. Good evening, Carla.
Good evening.
Hey.
Hi, Carla.
Thank you for holding.
Yeah,
what
can we do for you?
Hey, what's the chance of something bad happening if I get these removed?
Well, that's a great question. I'm so glad you called in with this. So here's the deal. We're going to get into this, okay? Mm-hmm. So now, Jeff, can you cover what do you do when you remove these?
Okay.
Because Carla, that's a great question.
I think it's a great question.
When you remove these fillings, you are at risk of absorbing a lot of mercury.
Correct.
Right?
That's correct. You know, and Dr. Joe and I have kind of talked a little bit about what's the best way to minimize any type of adverse effects with something like this. So first and foremost, we use what's called a rubber dam, which is kind of, you may even had something like this used in the past. Maybe if you've had a root canal or things like that. We routinely use it to isolate your throat and your mouth from any type of materials that we're taking out, whether it be silver fillings, mercury fillings, or gold. It doesn't matter. That's the first step. The second step is this high-speed suction system that specifically takes care of this, takes it, puts it into its own, isolated, disposable container, of which we've talked about. Unfortunately,
so you don't just throw them in the garbage.
Oh God, no.
Or down the drain.
No. We cannot do that.
So,
and that's an environmental hazard. But yet we're allowed to have them in our mouths.
So allowed to have them in.
And I'll tell you one more thing, Carla. We were through some of our research. Dr. Joe and I found some good supplements that we believe could really be helpful after you get your silver amalgam fillings out. That could really help your body as far as the immune system goes, boost things, and maybe we can get that on the website, Dr. Joe, the Simple Truths website.
Get that on the website.
I think that would be a very good thing, Carla. But that's a great question.
Thank you for calling, Carla. Yeah, I love have you ever heard he's as mad as a hatter?
Yeah.
Hatters back in the old days.
Right.
What did they use to help reblock the hats and make hats?
Mercury.
They used mercury,
That's
and
correct.
that caused you to become as mad as a hatter. Now, so you don't become as mad as a hatter, please. So what we recommend too, that's why I love Dr. Haddad's, your methodology of how you remove the mercury. You better be very high tech in doing this.
That's correct.
And this is going to boost our overall immune system and help the liver and help the nerve myelin sheath not to get MS and all kinds of other serious diseases that we might have or be on the brink of because of these fillings are lowering your overall resistance and immune system, and it's causing interference like cell phones, overuse of that. Now, there's dimethionine, which is an essential amino acid, and it's a sulfur base. We talked a lot about glutathione, which helps to pull toxins, heavy metals out of the liver, and this helps too. It's naturally in Brazilian nuts and alfalfa, sesame seeds. So if you're going to have the mercury amalgams removed, we really recommend you get on the Brazilian nuts, the alfalfa, sesame seeds, and have it removed properly by somebody who's an expert like you, Dr. Jeff. So
thank you for
that. Now this show has come to an end, and I want to thank all the listeners. Yes, and you can contact us. Get on our website, simpletruthsforhealthyliving.com, and Dr. Haddad's site is on that as well. And tomorrow we're going to be getting into some great natural recipes for Thanksgiving and continuing natural sweeteners. And remember that all that we eat, drink, or do, or put in your mouth, do all things to the glory of God. Good night, and God bless everyone.
Are you self-conscious when smiling for pictures? Do you ever cover your mouth when you laugh to hide your teeth? Do you want to regain that healthy, youthful smile you used to? You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.